Hi.
Hello. Hi. Okay, and see me? Can you hear me?
Yeah, I can hear you.
Okay.
Can
Okay, perfect. You froze for a second.
you see? Good to see you again.
You too. Sorry, I'm running a little late.
That's okay. Don't worry about it. Um,
Yeah.
so today, I know we're doing this on your channel, but we're going to be doing a little interview. I'm going to be interviewing you um, on women with narcissistic personality disorders because there are a lot of people who have women who are dating partners, whatever, right? Family members, friends in their lives who are dealing with narcissistic uh,
hmm
women with narcissistic personality disorder, and just women with narcissistic traits too.
hmm
And so we're going to be discussing that a little bit. So I'm just going to introduce myself really quickly, and I know people on your channel know who you are, but I'd still love for you to introduce yourself.
Someone said no audio. Can you guys just give us a thumbs up if you can hear us? Someone give a thumbs up if you can hear us. We're getting hearts, so.
Sounds like they can hear us.
Okay, perfect. Okay, cool. All right.
Okay, so I'm Dr. Aviva Gaskill. I'm a clinical psychologist just outside of Philadelphia, similar to you. I am the owner of Bet Me a Date, which is a dating website. And I'm wondering if you would introduce yourself to us, tell us a little bit about you and your work and sort of your experience with dealing with folks with narcissistic personality
Mhm.
disorder. Dr. Zucker.
Sure. So thank you for having me. I always love talking to you. Um, so my name is Dr. Jamie Zuckerman. I'm a clinical psychologist outside of Philadelphia in Ardmore. And I see adults mainly with anxiety and depression, some health psychology, a lot of neurological, I would say difficulties adjusting to neurological disorders. And also, I see a lot of women, primarily women, who are in relationships with toxic partners, more than likely people that have narcissistic traits, narcissistic tendencies, which we'll talk about the difference, or narcissistic personality disorder, which technically isn't used now, but we all still say it. So, and I don't, which is interesting, for the same reason as men, which we'll get into, I don't see a lot of females with narcissistic personality disorder for the same reason I don't see the men. They don't present to treatment because they don't think anything's wrong. They like how they are. So yeah, so they like how they are. So that's what I do.
So let's get into it a little bit. How common, and I think we can go back into breaking down the differences between someone who's sort of casually called a narcissist, because I think it's always important to review that, as I'm sure you do
Mm-hmm.
too, versus someone who has narcissistic personality disorder. But before we get into that, how common is it for a female versus a male to be someone presenting with narcissistic personality disorder?
So there's mixed findings on this. There's mixed research on this, again, for the sole reason that it's really difficult to get even approximation because they don't come in for treatment. So it is said that more men than women have narcissistic personality disorder. I think it was maybe, I want to say it was upwards of like 75%. It was a lot more. But there's a lot of issues with that. One being, a lot of times women are not identified as having narcissistic personality disorder, which we'll talk about. So it's not that it's misdiagnosed, it's that it's underdiagnosed. Um, Again, and we'll get into this, but the misdiagnosed component, um, people say, well, borderline personality disorder, narcissistic personality disorder. One of the key differences is people with borderline personality disorder, they're coming in for treatment. They may not have the best awareness at first or insight initially, but that's what they learn. But they're hurting. They want to come in for treatment. They may not understand why they're hurting. So it's not so much that it's misdiagnosed as that. I would sooner say by like secondhand reports bipolar disorder, which it's clearly not either. It's because people's understanding of bipolar disorder is usually inaccurate. So it's underdiagnosed rather than misdiagnosed across the board, men and women. But women are just perceived, the symptoms are still there, but they look different in females.
I mean, obviously I know the difference about this, but I think it's helpful to help people understand, again, why it's underdiagnosed, like you're saying, and that piece of like, we, right, as psychologists, we cannot diagnose someone ethically if they're not in treatment.
Correct.
Could you talk a little bit about like sort of why that is?
Sure. So, just like you said, when we get patients in our office, it's typically the partner of the person who is narcissistic, because they have gotten to the point where they're anxious, they're depressed, their marriage is falling apart, their self-esteem is just crushed. So that's who we get. And so we kind of have to, I say diagnose very cautiously, but we kind of have to go about this secondhand, with secondhand information from the person that's in our office. And I'm sure you would agree with me that when we hear somebody start talking about this, it's really easy to tell what's going on. It's really easy. It's if you are aware of narcissism and you understand the nuances, you know, I say this all the time, you can tell when you're speaking to someone for the first time on the phone, on the evaluation even. So there's no misunderstanding. Now, that being said, like you said, we can't diagnose, obviously, someone that's not sitting in our office. So they don't present for treatment. We can't directly direct. I will say sometimes, once in a blue moon, one of my patients will bring in their significant other. And one of two things happens every single time. Either they get up mid-session, or three things happen. They get up mid-session and walk right out of my office because they hate me. Because I know what's going on and their charm doesn't work.
Yeah.
Or somebody who is not aware of the nuances of narcissistic personality disorder, they will easily charm the therapist.
Yes.
So that's something else that happens, which, mind you, is extremely invalidating to the person who's your patient, because they're in a trauma situation. More likely than not, there's abuse, verbal, emotional, sexual, physical. So when you have this other person come into your office and they're charming and the therapist is not aware of this dynamic or doesn't understand it, it's very invalidating to the patient to have the therapist, and I've had this happen for people, therapists say to them, you know, you guys, he really seems like you, or she really seems like she wants to work on things. Maybe you should give it another shot. It's so invalidating.
And then they'll charm the pants off you.
Yes. And it's very good. And then the last thing that happens is they'll stay, but then they will never come back, and they will make their significant others' appointments to see me really difficult to get to. Like, I've had people, you know, take their keys and hide them, take their stuff, so they couldn't get to me. So, you know, it gets very tricky. So sometimes I don't even recommend bringing in the significant other. I really don't. Usually when the person starts working on boundaries with me and they go and they do this at home, or they're in the process of trying to leave the relationship, you know, you'll get phone calls, you'll get, you know, things you can't respond to, but it's kind of, and you would agree with this. So again, you can't diagnose it firsthand, but all of these things taken together give you kind of a pretty accurate picture.
Definitely. So can you tell us again, just like quickly, if we could like review some of those differences between sort of what people kind of casually refer to as, you know, oh, that person's such a narcissist, versus narcissistic personality disorder.
So if you think, I usually have a pen in front of me. I'm in my daughter's room, so excuse what I'm going to use to show you this. But we have a mermaid makeup brush. So if you look at narcissism on a continuum, and down here you have narcissistic personality disorder, and down here you have, let's say, extreme codependency, dependent, kind of toxic as well, just kind of different. Now, this is not clinical. This is just how I like to explain this. So where the person kind of lands on here is kind of indicative of what their symptoms look like. So for example, we all have narcissistic traits, right? But the difference between people that have narcissistic traits, tendencies have, is that it goes back and forth based on the context of the situation. So there are certain times where, like, if we need to speak about something as an expert, right? An expert witness or on the news or whatever, or even in this, our narcissistic aspects may be a little bit higher because we have to present in a certain way. However, when we're in a situation where we're learning something new and we have no idea what's going on, they tend to go down, right? So it's constantly in flux, and it is not a bad thing to have narcissistic tendencies at times, but know when to shift gears and kind of have them quiet down a little bit.
Like we refer to a healthy level of narcissism.
Healthy level of narcissism, yes, which is sometimes necessary. I mean, if you look at people who are in higher up positions in companies, or just in just certain, or not even high up in companies, just heads of certain situations or whatever groups, they tend to be a little bit more kind of bolder in their presentation, right? It doesn't mean they're narcissists. It's just sometimes those people are drawn to those types of positions. Now, the difference is somebody can be really selfish. They can be really self-absorbed. Sometimes even with depression and anxiety, because it's so focused inward, sometimes people with anxiety and depression look like they are being narcissistic. They're not. They're so in their own head that it just kind of appears that way outside. So there's that aspect, which isn't anything having to do with narcissism. And being selfish isn't narcissism. Sometimes being selfish is just some of your narcissistic traits are kind of showing up for whatever reason. Healthy narcissism. Also, being an asshole does not make somebody a narcissist. You could be with someone and cheat on them every single day with another woman, another man. You can just be a complete and total jerk. That doesn't make you a narcissist. It may just make you an asshole, or it may make you a mean person or a rude person. But again, it doesn't make you a narcissist. So I have a lot of women who'll say, he's such a narcissist, he blah, blah, blah. That's not narcissism. Yeah. It's just someone being an ass. Somebody who has narcissistic personality disorder, one, is not able to ever shift gears from having narcissistic traits. They are permanent. They are there. There is nothing that will ever get rid of them. Treatment does not help for this. They don't care. They don't have insight into the impact that their behavior has on others. Somebody who cheats on their girlfriends, they may be an ass, but at the same time, they are aware that what they did was wrong. They do feel bad. Maybe they feel guilty. They may never let you know that. But a narcissist wouldn't look at it like that. A narcissist would look at it as they're entitled to be with whomever they want, whenever they want, and they don't owe an explanation. There's no remorse. There's no awareness of how it impacts other people. Other people don't exist, literally, unless in that moment they need something from them. So it looks very, very different. And some people say, well, they're really sweet in the, I was in a relationship and they were so nice in the beginning, and then all of a sudden they just weren't. Were they narcissistic in the beginning? Yes, they were. What they were doing was putting on this act, which was very deliberate, to suck you in, which is part of narcissism, and then kind of keep you stuck and then devalue you. And that's kind of when the abuse starts. So it's very different than having narcissistic tendencies.
Yeah. So I wanted to ask you, because I think this is really tricky, and one thing that kind of gets into the nuances, are there certain common traits that you see that are different between women with women who have narcissistic disorder versus men and males that have narcissistic disorder?
Yeah. So again, I'm making a very big generalization, but typically with men who are narcissists, you will see more physical violence, you'll see more physical assaults, you'll see more sexual abuse. You will see more kind of outwardly aggressive behaviors, punching walls, throwing things, things like that. That does not mean that female narcissists don't do that either. They do. It's just more common presentation for a male. Now, there's, again, a couple things with this. It's underdiagnosed in women. And if they are abusive to their male partner, a lot of times men won't report that because they're not going to tell people, either they feel guilty or shame or embarrassment that their female partner is throwing, a glass at their head or punching them in the face. I mean, chances are they may not be reporting that. So it's a very tricky situation. So I'm not saying that females don't do that. I'm just saying that the presentation is more obvious with men because their partners, the women, are the ones that usually come in for treatment. Yeah. The other thing is women have a tendency to both manipulate. That's a given. Women tend to manipulate a little bit more on three things. One is guilt. They use guilt significantly more than men do. Women also will tend to use emotional coldness. So withholding affection. You see this a lot with mothers, with their children, mothers who are narcissistic. One of the ways that they manipulate the child is withholding love and affection at really random intervals. So the child never knows what they're getting, doesn't know how to get love because it switches up every 5 seconds. So they use that a lot. The other thing is same kind of concept, but with information. They withhold information. They will use it to their benefit. They won't tell people certain things. They'll tell half-truths. Again, all of this stuff is the same with men as well, but it's just, this is kind of the style more so with females. Also, female narcissists, like men, but it's a little bit more obvious with women, I think, just because of how society kind of just portrays females in general. But women narcissists tend to, there's kind of two variations of this, be super, super competitive to like an unhealthy place. Like they don't care who they step on. They're going to get ahead. They're going to win. They'll cheat. They'll do whatever they need to do to get where they need to be. Then there's also female narcissists where everything is, it's not necessarily aggressive and manipulative outwardly, but it's more that martyr syndrome kind of, everything happens to me so much worse. Oh, you think you have no idea what I've been through. And so they kind of gain their fuel from other people by their lives always being in such chaos, yet they're not receiving help, and the chaos they're describing doesn't match up with their environment. And so that's very common.
Like one-upsmanship, but in the negative kind of sense.
Yes, exactly.
Are there other kind of social things that women who live with narcissistic personality disorder kind of tend to do maybe more so than men, or that you've seen a little bit more with women or heard women report or men report about mothers, sisters, girlfriends, wives, right, that are living with narcissistic personality disorder than with other men in their lives that do that?
So females from a mother, in a parenting situation, let's say, the men who are narcissists tend to be very absent, neglectful, but not neglectful in terms of the actual parent, just totally disconnected from the family, checked out, only dips in when they need a benefit in some sort of way. Female narcissist tends to, like I said, kind of that hot and cold. I think the old I think refrigerator mom, maybe there's like this old terminology for it, but it's this hot and cold, never know what you're going to get. The other thing is narcissistic parents mothers in particular, and again, there's probably societal influence on this, tend to be extremely overbearing parents, but not because they're anxious. We all know anxious moms that are like, oh my God, are you okay? Are you okay? I don't want you to do this, this, or this. What if you get hurt? Blah, blah. This is different. This is a blatant violation of the child's boundaries at any age. Interfering with their lives, taking over, interjecting themselves in, I see this a lot with female narcissists when they have a child that gets married, and the level of infiltration that they try to get into this relationship because they're gonna be the center of this relationship.
Yeah.
Things like birthday, usually the moms, again, I'm making a very generalized statement, usually the moms are the ones who are kind of planning the birthday parties for their kids and the school stuff and things like that. A narcissistic parent will do things like throw the birthday party, but then cause chaos. Ruin the day, let's say, or a wedding, for example. They purposely will argue with their child on that day so that not because they want to steal the spotlight and not because they want to ruin the day, but they still want to make sure that they have access to their child's emotions so that they can change them if they want to.
Yeah. I've heard of people showing up to their own child's wedding, right? Like in a wedding gown themselves. Things like,
yes.
Whoa.
Correct.
So I'm going to ask this question a little bit of a different way, but I wonder how a narcissistic woman may affect someone in the dating world. Things that you see kind of just broadly.
It's very similar to men, to be honest. It's very, in the beginning, they may come off very caring, again, depending on what the other person is, what their vulnerabilities are. So let's say it's somebody who really wants someone to take care of them. That's how they'll present. Very nurturing, very loving, very caring, doting on them to get them in. And then once they're in, that changes. And now you have this other person who wanted to be taken care of, who no longer is being taken care of, but it has been so manipulated and kind of sucked into this, they can't get out. Or you have somebody who's very nurturing and loving and then just turns cold. Again, it's the same pattern as men. It's whatever that person's vulnerabilities are. That's kind of in the beginning, that love bombing phase, what they do, and then they'll switch. So it really looks the same.
Do you think that sometimes, like I know you've described this kind of pulling away thing where more so with men, that sometimes men with narcissistic personality disorder will tend to pull, let's say, their partner away from their friends, family. Like sometimes they'll even like kind of say, oh, we have to move away, and they'll like actually like move them to a different place. Do you see that happen as much with women, or you do?
Yep, absolutely. I do. One of two ways. I either see it as they isolate slowly their partner from the world around them. I like to describe it as like a bar, and it's so subtle, so you don't realize it. Because a lot of people say, I can't believe I didn't see this. Well, of course you didn't see it. That's the whole purpose. You wouldn't have seen it, because why would you? And so it's these subtle bars that get put up throughout the years. Before you know it, the partner is like kind of in this cage, and they're isolated from everyone around them. This is because then the narcissist has total access to them and no one else for them to bounce these stories off of, to confirm for them, no, you're not crazy, you're right. They lose all of that, and that's on purpose. With a female, you have that for sure. But what you also have is the flip side of that, where the family members of their partner, they strongly dislike the female kind of, they tend to kind of take, like, you pick me or them kind of thing, like between, let's say, their male partner and the mom, or the male partner and their sister. Pick me over them. And then that's kind of how that tends to separate from them. So it definitely happens in both. It's a little bit more like of a power struggle. It tends to be more with females than the opposite.
What about this idea of like, I call it a benign narcissist. I'm trying to think. I've heard other people talk about it, right? Like there are kind of narcissists where they come off as really, really sweet, and they remain really sweet in certain ways, even on some level to their partner. And yet, again, they're like these super manipulative folks who do have, narcissistic personality disorder, but like much harder to see it in certain ways because they're
Yep.
much more socially appropriate. Could you talk about that? Is that
Sure.
more
Um,
from what you say?
Maybe a little bit in the sense of it may look like a really loving mom because they're
Mm-hmm.
so involved. Or in the way of they're such a good wife or such a good girlfriend. They're so attentive to like all of your needs.
Mm-hmm.
So from that respect, maybe it's a little bit different, but the function of it is exactly the same. And what I mean by that is kind of what they're trying to get from it is exactly the same. It's just dressed up differently. It probably looks a little bit more nurturing and doting and caretaking-ish for the female than it would for the male. The male is more kind of more outwardly abusive. Still can be very charming. And again, can be very manipulative in very subtle ways, like you're saying. So, for example, you come home and you have a haircut, and they say something like, "I I like it longer,"
Yeah.
or you come out wearing something brand new, you're all excited, and they're like, "Really, you gonna wear that? I like the black one." So it's these subtle manipulations where in isolation, none of it looks weird or bad. I mean, we've all had many times where we come and our friends are like, "Oh, I don't know if I would wear that if I were you," right? But when you have that all the time, constantly, there is a very good reason for that. It's to wear you down without you realizing. So they do seem very charming, both men and women, but it's not without these little digs.
Yeah. Yeah.
Kind of that covert, very hard to identify, which is why it's very important if you are dealing with that, you have to find a psychologist, therapist that gets that, because that's when it can become dangerous, that the person coming in for treatment can really start to feel invalidated.
Yeah, yeah, so much so, so much so. It's so hard. I wonder if there's anything else that you feel like might be important to mention about women, who live with narcissistic personality disorder, again, and their male partners, or, just family members, anything. Or if you want to answer any of the questions, I know that there are a couple of people that sort of threw a couple.
Sure. So I'll just kind of give it from a mother standpoint, parenting standpoint, because I know there's probably a lot of people watching who had a narcissistic parent as the adult child. So a lot of times a female narcissist will have if they have multiple children, will have a very obvious golden child, very obvious. And it's a way that they kind of what's called splitting between family members. They will dote on this child and make it so painfully obvious that it's their favorite child. But again, other than the obvious dangers of that, they also have very high expectations of this child, because any child of a narcissistic mom, they're an extension of them. They don't exist separately from the narcissist. They are in fact a like an appendage almost. So if they fail, it has nothing to do with them failing. It's a reflection of you. So there's that aspect too. A lot of times narcissistic moms will do things like, and men do this too, but you see this with moms a lot, random silent treatments. Absolutely random. And they will withhold not just love and affection, they'll just flat out not speak to you. And you will have no idea why. And this could go on for weeks. And as you get older, this doesn't stop. It just looks different, because now what they'll do is they may go to your spouse and kind of try to split you and your spouse, or go to their grandkids and try to split you from your grandkids. So it shifts over time, but usually with the woman, it takes on more of like that kind of maternal situation more so than the men.
I mean, I've definitely seen that happen with people's grandchildren too, right?
Yes,
yes. People don't necessarily chill out with this when they get older, right? Sometimes it can even intensify.
Yep. You're parenting wrong, or they'll say to the kid, mommy's the mean one. I'm going to let you, have this, and this, rather than respecting your boundaries as a parent, again, they have no respect for your boundaries because they don't exist to them. They're irrelevant.
Yeah. Yeah. So is there anything else, or I don't know if you want to kind of...
I can take some questions. Yeah, I don't have my glasses, so I can't read anything that's on.
And
I'm sorry.
See. Somebody threw out... what's the best way to deal with a child narcissist? 7 years of long periods of not talking to us.
The child is the narcissist?
It sounds like the child, sounds like an adult child, or at least a teenager child is a narcissist. Sounds like probably an adult child.
Oh, it's so tough. It's so tough. I don't really have a good answer for that, except I would, if you want to initiate communication, do so.
He's 30.
He's 30. If you want to initiate communication, do so. I always like things when you're dealing with a narcissist, I like things in writing, because if it's not written down, not only was it never said, but it was said in a totally different manner, and you're lying and they're lying. So put it in writing, email, text, it doesn't matter. And try to use as few emotion words as possible. So things like, I'm really upset we're not speaking, or, this is killing me, or why are you... Instead of doing that, keep it very basic, keep it very simple. Hi, how are you? Wanted to check in and see how you're doing. That's it. Because any emotion words you give them, they will hold on to, twist, and then the whole point of whatever it is that you said is gone. And before you know it, you're defending something you don't even know what you're talking about anymore. So leave emotion words out.
Yeah, it's I always like to think of like a dragnet, or like just the facts, right?
Yes,
like,
just the facts.
Right.
Just the facts. And also, the hardest thing I think for people to keep in mind is that, and I hate saying this, especially as a psychologist, and you will agree with me on this, but they will never change. They will never change. And for us to say that is very painful, because we always want people to get better. If they seem like they're changing, they're doing it because there's some sort of motive behind it, and it will go back to how it was. So there is no changing. And, another thing people say, so that whole time I was with them, it was manipulative. Yeah. And they knew what they were doing. Yeah. They did.
Well, and going back to this parent thing, right? It's so hard thinking that someone that you raised and not sort of going into yourself, and also wanting to have an emotional connection with your child. But what I'm hearing you say is like, it's really so hard to have an emotional connection with a child like that.
You almost have to grieve the loss of the relationship you thought you'd have with your child. And or maintain the relationship, but like you said, just the facts. And if you find yourself kind of being sucked into it, set a boundary. It's so important, these boundaries that you set for yourself, not for them, for yourself.
Yeah, because they'll run over they'll just steamroll.
Yes, they will. Yep.
Somebody else mentioned, and this is also an adult child situation, it sounds like, they said the enmeshed husband and the narcissistic mother-in-law, which is too, that like, so I'm assuming it's the woman that it says, the enmeshed husband and the narcissistic mother-in-law, especially when it comes to my children, help.
So her husband and his mom.
Who the mom's a narcissist.
Yeah. So in those situations, it is super important for your husband to make sure that he and you always present as a unified front. You are not two people, you are one. To her, you are one. And if for any reason she goes around you to get to your husband about an event, a party, or just happens to give your husband the information, but not you, and you show up and you don't, on purpose to make you look bad, any correspondence needs to be an email, text, in writing, and every correspondence that he receives, his response is with you copied on it. To constantly make an effort to keep you unified so that no splitting occurs. And he has to be able to set boundaries on your behalf for you, for your relationship. And if he's not willing to do that, that's when I always suggest couples therapy, because there's reasons why he's not agreeing to do it. It's not because he doesn't love you. It's a long history of kind of being trained to not do that.
Anger, right? Somebody said, so she said, thank you. But that person who said, I'm having a hard time, sort of believing that like my child's never going to change. I know it's really hard. Like, it's exhausting. It's brutal. But
I can't fathom it as a mother, I can't imagine that either, which is why I say reach out, but you have to leave those emotion words out. And, at a certain point, I say this, everyone, we always blame, we can blame our parents for, all of us have our stuff, right? Every single, you, me, we all have our stuff. Everyone on here has their stuff. And up to a certain point, we blame our parents, right? And my kids will blame me, your kids will blame you. But at a certain point in adulthood, you have the ability to shift gears. You have the ability, with therapy, without therapy, to set patterns that you want and be the way you want to be, even if it's difficult, regardless of what you were taught. And if things don't go right, at 50 years old, you can't still blame your parents, right? At some point, it may not be fair, but it is your work to do. Yeah. You may not have caused it, but it is your work to do. So I kind of relate that to this in the opposite, is that, as a parent, you can only kind of blame yourself so much, but then at a certain point, your child had the ability to go a different route. And for whatever reason, they chose not to identify their patterns as toxic. They chose not to, have any type of anxiety or guilt about their behaviors. And again, at a certain point, you just can't be at fault as the parents anymore. So I wish I had an easier answer for this. It's very difficult. It's very difficult.
Really painful. Yeah. I think that's so important too, right? Like that you're not saying that lightly. I know.
No, oh, no. Yeah, no. One of the hardest things that breaks my heart when I work with people, usually the women of narcissists or children of narcissistic parents, that one breaks my heart the most, because when they say things like, so they knew the whole time what they were doing to me, and I have to say, for the most part, yes. I mean, I'm sure some things were habitual by then, but meaning automatic, right? But yes. And they'll say, well, so my dad didn't love me, so my mom didn't love me, so my wife didn't love me. And what I always say to them, and again, I hate saying it, but they loved you the best they could when you were following everything they needed you to do in any given moment. Mm-hmm. And in that small context, they loved you. Mm-hmm. Step outside that context, you're dealing with something different, because then that's when the manipulation starts. So it's traumatizing. It's traumatizing. It's traumatizing for everyone involved.
One last question. Somebody said, my husband has acknowledged his behavior. Can a narcissist do that?
So I'll say two things to this. They either acknowledge their behavior to just say it in therapy to look good, to get somebody off their case, to get someone to stop bothering them, to pretend like they care to make it work. Or, yeah, they acknowledge their behaviors. Maybe they'll say they'll change, but they acknowledge their behaviors, but they like them. And they may say that they know they're toxic, but they have no intention of changing them.
Yeah. I was thinking it would be very easy for someone to say that before you're ready to walk out the door, right?
Absolutely. That's what I'm saying. There's a reason why they'll say it, right? Exactly. If you're threatening to leave, well, I know I do X, Y, and Z. I know I do this. I promise I'll change. That's with the function of getting you back. And the same would apply for female narcissists as well. You know what I do. I'll change. I promise, just don't leave. And that's when you see that happen.
Yeah. Yeah. Well, thank you so much for talking with me. Again, I know this is your channel, but where can people who are interested find out more about you and
sure.
that you're doing? I know you're now too.
Yeah, so I have a group. It's actually starting next Wednesday again. It's the second go round of it. I can only see Pennsylvania state residents, unfortunately, for therapy. So if you are a PA resident and you are dealing with a partner, a parent, whomever that is a narcissist or that you believe to be a narcissist, there's a link on my website, drjamiezuckerman.com. You can click on to submit to join the group. I have about 2 spots left. I keep it relatively small because it's, as you can imagine, it's very heavy stuff to talk about. And my Instagram, drz_psychologist. And yeah, so that's where you can find me. And for my followers, can you tell them where to find you as well, and your dating app and where to find you?
Yeah, so I'm Aviva Gaskill. My Instagram is @betmeadate, @betmeadate. It's one word. And I'm trying to help people date more meaningfully, especially people who have had dating issues, people who have been burned in the past, maybe by someone who was a narcissist. And it's hard to it can be really hard to put yourself back out there again after that. So I'm helping people to try and meet their dating goals. So that's betmeadate.com. And also have a private practice. So Aviva Gaskill, and it's a group practice. So yeah, it's good stuff. And I see a lot of folks dealing with narcissistic personality disorder, folks in their life. Like you, I'm a health psychologist. And so a lot of family members will just especially if they're narcissistic, if they were the caretaker and all of a sudden they get sick, that narcissist will just drop them.
Yep. Yep. And I'd imagine also you would see a lot of people coming in, and for those of you watching, I'm sure you can relate to this, but for people, men and women, who are the partners of a narcissist, one of the things that happens is they're so scared to show any emotion. They're so withdrawn emotionally and just they describe themselves as a shell of their former selves. They have a lot of somatic, physical illness that results, flare-ups, inflammation, migraines, because it has to go somewhere, and it's safer within their dynamic to have a headache than to be sad. And so, I'm sure you see this too, that the stress, it goes into your muscles, it goes into your tissue, it comes out, it's going to show its face somehow.
Yeah. And that's not to say that you're not also dealing with, a serious medical issue, but as you said, this really worsens it.
Yeah.
And I've seen the other end of it too. I've seen people who, are caregivers of someone who is very, has a medical condition, but also has narcissistic personality disorder or trait. And, is just, they could grovel at this person's feet, and
and it's not enough.
Yeah.
Right.
Yeah.
Right. And they lose their livelihood. They lose their lives. They lose their identity. Right. And nothing's ever good enough. Yeah. It's very hard.
Really hard. Thank you so much for doing this with me tonight.
Thanks for having me.
Yeah. Take good care.
Bye-bye. Thank you so much.
Thanks.